Okay, I wanted to do this special little video about the wound for those of you that are having a frenectomy. Okay, so the most important thing is that we have to get amazing healing. This means you're going to have to work hard. We can recover from a lot of things, but if we get a poor job of healing, then it's really, really difficult. And oftentimes I have to send my clients back to have another frenectomy. So I'm trying to help you not do that. The one thing is some doctors do stitches, some do lasers, some do a combination of both. So this is a little bit hit or miss. The most important thing that I want to tell you is it is your doctor's responsibility to go over this with you. The reason that I dive into it is because I've been there. I've gone through it with my granddaughter. I watched my daughter do the stretches and exercises. So that's why I feel like it's really important. I always tell my live clients that this isn't necessarily in my scope of practice as far as wound management, but I can share this information with you because of the fact that I've gone through it. And then I do see my clients, I go to the doctor's office with some of my local clients and I watch them have their frenectomy. So I'm going to give you some general information, and then for the absolute recipe of what your doctor wants you to do, you need to talk to him. I always say it's his wound or it's her wound, so it's their responsibility to tell you how to take care of it so that you can get good healing. But I have experienced so many times that they don't. That's why I'm going to go over this with you. So first thing is I want you to start preparing ahead of time. Dress rehearsal is really important. So knowing what it feels like to work in your mouth, what the tissue feels like, that kind of stuff is really important. So I'm going to first talk about if you have a wound and you don't have stitches. Okay. This is probably going to be the only wound of your life that you keep broken open. So like if you were growing up and you had a sore on your arm and you kept picking at it, your mom would probably smack your hand. That's not the case here. We want that wound to heal by secondary intention. And so that means from the outside edges in. So you're going to get this diamond-shaped wound, and we want it to heal slowly from the outside in. I always say that you want to close the curtains, not the window. So we don't want it to heal back down this way. And your mouth is amazing at healing. So from the very second that your doctor releases it, it's going to start healing. So you have to get with the program for sure to take to keep that broken open and disrupted so that it heals from the outside in. So when my daughter went through it with my granddaughter, she would wash her hands and then she would I call this getting your guns out. So she would get in there and just kind of roller pin, if you will, that area to keep it from adhering too fast. Then she would kind of go sideways, so you can ask your doctor about that. But if you practice getting in there and knowing what that tissue feels like and how much pressure, that's going to really be helpful. I also used to teach that it was kind of like a forklift. So you're wanting to lift the back of the tongue. But really, because I have you do suction and hold, that helps the back of the tongue. So remember, there's a difference between exercises and stretches, and I just want to go over this step with you so you have an idea as it gets closer to your frenectomy, because your next lesson is going to be within 48 hours of having your frenectomy. And so we'll talk about that again, but I just wanted to give this information to you ahead of time. So that's laser. That wound, doing that wound disruption is going to be important to do around the clock. So some doctors have you do it every 6 hours, some have you do it every 4 hours. I want you to ask your doctor what their recommendation is. Next, let's talk about stitches. So when a doctor puts stitches in, it prevents the tongue from healing back down this way, but it makes it harder as far as my job for myofunctional therapy and that functional movement. So I always tell my clients, if you're going to have stitches, that the exercises that I will teach you in lesson 3, which are your post-procedure exercises, those are going to be a little bit more difficult. And I kind of get more into that in lesson 3. So just so you know, laser stuff, or if you don't have stitches, you're going to have to do wound management. And if you do have stitches, you don't have to. So dress rehearsal is a must. I will see you guys in the next lesson. Bye for now.